Good afternoon, live from Toronto and the GBCam network. This is the Chat Up Show, the show where we catch you up with the chat up of our weekly headlines. I'm your host, Elizabeth Aloyde, and I hope that you are ready to chat it up with me today. Now, as always, you know you can keep up with the GBCam network in various ways. You can continue to listen and watch live 24/7 at www.gbcam.tv or www.gbcam.fm, where you can also check out our past shows, like, share, comment, all that good stuff. Also, make sure you download our free app that has the exact same features as on our web station. So that's listening and watching live, checking out past shows, like, share, comment, looking up the upcoming show schedule, all of that. And when we go live, you will be notified. So make sure, download the free GBCam app available for all iOS and Android devices right now. Just search GBKM and turn your notifications on so you won't miss another live show. You can also continue to watch us on Facebook and YouTube at GBCam Network, where you can like, share, comment, and subscribe. And you can follow us on Instagram and Twitter at GBCam Network, where you'll receive updates on what's going on with us right here at GBKM. Also want to make an announcement. We have a very, very exciting event that's happening this weekend, or actually 3-day event that's happening Thursday, Friday, and Saturday. So it's December 2nd, 3rd, and 4th. It is the the Council of Nigerian Professionals event, The Power of Inclusion, What's the Fuss About? So make sure you check out on our page. We've been promoting it for a while now. If you've missed it for some reason, you know that you can find this. There's a great lineup of guests and speakers and panelists that you will not want to miss. Again, this is a 3-day event. It is a hybrid event, so it will be broadcasted virtually over Zoom for the first 2 days. And then the last day is an in-person/virtual event as well, where we will be covering the red carpet. So I hope to see you then. Make sure you check it out. It's CNP Power of Inclusion. So make sure you sign up and register right now so you don't miss this amazing, amazing event. An opportunity to hear from people who are inclusive, who are movers and shakers within our community right here in the GTA. So there's our little updates. Now, Christmas time is coming. We're all excited. We're all in the festive mood. I mean, maybe not all of us, but I sure am. I've already got the Christmas music playing. It's December 1st. It's time to go. However, we know that we are still in the middle of a pandemic, and this year is looking a little similar, but with a twist. And the reason I say it's with a twist is because we know that there's this new variant that it's rearing its ugly head currently, called Omicron. Currently, Canada has found its first 2 cases of Omicron COVID-19 variant of concern, and was confirmed as of Sunday in Ottawa. Now, this variant, which has been said by experts to be more transmissible than previous variants, we know that there was the Delta variant before. It was first identified in South Africa, where it coincided with a recent spike in COVID-19 cases, but it's unclear where it first originally emerged. We just know that we're seeing a lot more cases in Southern Africa as opposed to other places in the world. And now, of course, it's making its way around the world. So Omicron, let's find out what it is we know about this new variant, because I think the more we're informed, the more we can prepare ourselves, we can protect ourselves, especially during the Christmas season, that a lot of people are wanting to travel and just gather and be with family and friends and loved ones. I mean, we're entitled to it, right? This has been a weird year and a half. It's taken a lot of getting used to, and we want to be able to keep some semblance of normalcy as much as we can, but as long as we're staying safe. So as long as we know what this variant is doing and we're aware of as much information as we can get right now from our experts, we know how to better protect ourselves and those around us as well as we go on into the festive season. So what is Omicron? So Omicron is the new variant of COVID-19, as we mentioned, that was essentially designated as a variant of concern by the World Health Organization. Now, the UN Health Agency also gave the variant its name following a classification system, as we see on the screen, following the Greek alphabet. So we know we had the Delta, there was of course the Alpha, Beta, and Gamma. Now we have Omicron, which is the B11529 variant of COVID-19. Now, the WHO said that the variant has a large number of mutations, some of which are concerning. I just want to do a disclaimer that this isn't information that's trying to scare anybody or try to add any more anxiety. It's just so we know what we're dealing with and we can protect ourselves and stay safe. That's what this is all about at the end of the day. It does sound concerning when you hear from the World Health Organization that this is a variant of concern, but as long as we can stay ahead of things and we can keep up and understand what our experts are saying and listen to our health experts and health officials in staying safe, we will hopefully continue on, staying safe and healthy as much as we can during this pandemic. So preliminary, there we go, that word is a little hard, evidence shows that it has an increased risk of reinfection. So we know when the pandemic first started, there was a lot of conversation around how if you've already gotten been infected with the virus before, your chances of being reinfected again are a little lower because now your body is developing the antibodies and how science works. But our WHO is saying that this variant, the Omicron, has a increased risk of reinfection, that even if you've been infected with it before, the chances of you being reinfected again is a little higher than other variants due to the mutations. Now, Canada's Chief Public Health Officer, Dr. Theresa Tam, said on Friday that some of the mutations detected show a potential for greater transmissibility as well. So it's easier to pass around this current variant, and it could also reduce natural immunity as well as the immunity offered by vaccines. Of course, just going back to the risk of reinfection, those antibodies, due to those mutations, the chances of you being able to fight it back again, by fighting it back again and not being reinfected, are a little lower. As we know, it's increased risk of reinfection. So where has this variant been found? Outside of South Africa, Omicron cases have been confirmed in a growing number of countries around the world. For example, Canada, Netherlands, Israel, Australia, Germany, Belgium, UK, Hong Kong are among those that have a reported case. In fact, we actually have a full list of countries that have reported cases and how many cases they have as of this morning. So what we know right now is that Australia has 7 confirmed cases of Omicron. Austria has 1. Belgium has 1, Botswana 19 cases, Brazil has 2, Canada has 6 confirmed cases right now, Czech Republic, France, Saudi Arabia all have 1 confirmed case, Denmark, Hong Kong, Israel have 4 confirmed cases, Italy 9, Japan 2, Netherlands 16, Nigeria 3, Norway 2, Portugal 13, South Africa has a whopping 77 confirmed cases, Spain 2, Sweden 2, and the United Kingdom 22 confirmed cases. So this variant is essentially making its way around the world, and cases are increasing and rising as the days go by. And as time will tell, we'll get a better understanding and a better grasp of what the spreading or the contagious properties are of this new variant as well, to see how fast it would potentially spread within our population. But that's what we know for now. Now, Portuguese health authorities have identified, as I said, about 13 cases of Omicron in members of a top soccer club. So they are investigating possible local transmission of the variant due to the cases coming up in the soccer team. And that would be the first reported instance of local transmission outside of South Africa. So what we know right now in terms of the transmission of this variant is that a lot of it is from those who are traveling to other countries, from countries that have higher cases, which has been reported as Southern African countries having the higher cases. South Africa having 77 and Botswana having 19 cases. So now we're seeing that in Portugal that this was the first reported local transmission, that it wasn't from people who had been traveling, that it was found amongst the sports team, the soccer team that has, been in their own bubble. Dutch health authorities said Tuesday that the Omicron variant was already in the Netherlands when South Africa reported it to the World Health Organization last week. They said that they had detected the variant in samples dating from November 19th and 23rd. So that was essentially kind of before we started really noticing how much this variant was popping up in samples. And so the Netherlands had noticed it before South Africa had reported its cases. So that kind of gives a little confusion as to where this variant really originated from.
December 12th on
because
CNN.
we're seeing, in Netherlands, for example, that they had already a case of the Omicron variant.
The 15th annual CNN Heroes All-Star Tribute,
before South
Sunday,
Africa
December 12th at 8 Eastern.
Reported
pretty much
cases.
any time we've seen a new variant, it's already spread around the world. So the fact that Omicron is in multiple countries in Europe, in the U.S., is not necessarily an ominous sign. And I think that's a key point to keep in mind. And also remember, we've not seen any evidence.
Canada's #1 African barbecue, the Suya Spot, serving and satisfying your Suya needs from multiple locations across the GTA, including Scarborough, Toronto, Woodbridge, and Mississauga. Also located in Winnipeg, Manitoba. Visit any location today or stay home and order through DoorDash, Uber Eats, and Skip the Dishes. For more information, check out our website at www.thesuyaspot.com or call the toll-free line at +1 866 448 7892. The Suya Spot. You built it, now use it. Vous l'avez construit, utilisez-le. Canada's #1 African barbecue, the Suya Spot, serving and satisfying your Suya needs from multiple locations across the GTA, including Scarborough, Toronto, Woodbridge, and Mississauga. Also located in Winnipeg, Manitoba. Visit any location today or stay home and order through DoorDash, Uber Eats, and Skip the Dishes. For more information, check out our website at www.thesuyaspot.com or call the toll-free line at +1 866 448 7892. The Suya Spot. You built it, now use it. Vous l'avez construit, utilisez-le. Canada's #1 African barbecue, the Suya Spot, serving and satisfying your Suya needs from multiple locations across the GTA, including Scarborough, Toronto, Woodbridge, and Mississauga. Also located in Winnipeg, Manitoba. Visit any location today or stay home and order through DoorDash, Uber Eats, and Skip the Dishes. For more information, check out our website at www.thesuyaspot.com or call the toll-free line at +1 866 448 7892. The Suya Spot. You built it, now use it. Vous l'avez construit, utilisez-le. Canada's #1 African barbecue, the Suya Spot, serving and satisfying your Suya needs from multiple locations across the GTA, including Scarborough, Toronto, Woodbridge, and Mississauga. Also located in Winnipeg, Manitoba. Visit any location today or stay home and order through DoorDash, Uber Eats, and Skip the Dishes. For more information, check out our website at www.thesuyaspot.com or call the toll-free line at +1 866 448 7892. The Suya Spot. You built it, now use it. Vous l'avez construit, utilisez-le. Canada's #1 African barbecue, the Suya Spot, serving and
Hello and welcome back to the Chat Up Show. I'm your host, Elizabeth Aloyde. We do apologize for the technical issues we're just having just then. But before we went on our quick commercial break, we were discussing the Omicron cases that have been confirmed across the world. And now we know in Canada, the first 2 cases were confirmed in Ottawa, and they were found in people who had recently returned from traveling in Nigeria. And then 2 more cases were confirmed in Ottawa Monday night, and 2 more possible cases are being investigated in the Hamilton region right now. Now, Ontario's top doctor said Monday it would not be surprising to see more cases, adding the province is performing genome sequencing on all eligible positive COVID-19 tests in order to help detect the variant. So what does that mean? It means that they're going to look at the test and see which COVID variant it is, to see if it was Omicron or if it is the Delta variant that we know was really popping up over the summer and even into the fall as well. So now there's a lot more testing going into that. Of course, it is still early days, as we know that a lot of these cases are just starting to pop up right now. So over the weeks and over time, more as we roll into the Christmas season, into the new year, we're going to be learning a little bit more about this new variant and what it would look like in the future and how it could impact society and how we interact with each other and how we are dealing with the pandemic overall as well. Quebec also confirmed its first Omicron case on Monday, and Alberta and British Columbia each have announced their first cases on Tuesday as well. So we're seeing it pop up a little bit more in Canada. So what is Canada doing to help, ensure the safety of all of us here right now? As of Tuesday afternoon, the federal government announced that all air travelers entering Canada, except for those coming from the United States, will need to be tested for COVID-19 upon arrival and isolate until they get their results, even if fully vaccinated. So if you're thinking about traveling or you're thinking about coming back to Canada after your travels, keep in mind that you will be required to be tested upon arrival, and you will have to self-isolate and quarantine until you receive your test results negative test results, even if you're fully vaccinated. I mean, we know that before, if you were fully vaccinated, you wouldn't have to quarantine as long as if you were unvaccinated. But for now, you would have to quarantine for some time until you receive the negative test results back and the go-ahead that you can exit out of isolation. The government said it would consult with provinces and territories before bringing in similar measures for travelers coming from the U.S., as we know that but for right now, this new restriction does not apply to those who are traveling from the U.S. currently. Canada is also expanding its border closures to foreign nationals who have recently traveled from certain countries. Now, we know that there was a ban last week on southern African countries, but that has increased now to other countries, not just in southern Africa, also north and west. Canadians and permanent residents who recently traveled through the 10 countries that I'm about to list now will be subject to mandatory quarantine. So regardless of what's going on, you would have to quarantine if you've traveled from these countries. So let's take a look at the list of countries that have been put on the list in terms of travel restrictions. So it says on the Government of Canada website that foreign nationals who have been in any of these countries within the previous 14 days will not be permitted entry into Canada unless you are a permanent resident or citizen. So Botswana, Egypt, Eswatini, Lesotho, Malawi, Mozambique, Namibia, Nigeria, South Africa, and Zimbabwe is on the list of those countries where foreign nationals will not be permitted entry into Canada. But if you are a foreign national but you have your PR, as I mentioned before, you will be able to re-enter the country. Of course, you'd still have to go into isolation just as any other traveler would in Canada. So just to repeat the list of countries again, just to remind you, the countries that foreign nationals will not be permitted into Canada are Botswana, Egypt, Eswatini, Lesotho, Malawi, Mozambique, Namibia, Nigeria, South Africa, and Zimbabwe. So if you were thinking of going to any of these countries to spend Christmas with your families or just for a quick getaway vacation, just know that it will be very difficult to re-enter Canada if you are not a Canadian citizen or permanent resident, as the border is essentially closed to passport holders of these nations. It's hard, especially around the Christmas season when, we are such a diverse community here in Canada, and there are a lot of people who come from different countries around the world. And when you see your own country on a list of countries that essentially have been banned from entering Canada, it kind of puts a sour taste in your mouth, right? It doesn't feel good. But it's just remembering that right now the government doesn't fully understand how this new variant is moving, because it's moving a little mad, can't lie, just to get a hold and a grasp of things. This is the routes that they've decided to take, which isn't new. We've had border closures throughout the pandemic. It's just that for the most part, it was complete border closures, does not matter where you're coming from. But now, of course, there's the list of specific countries now because of reported cases coming from, Southern African cases or people who are traveling from these countries, like Nigeria, for example, with the 2 cases in Ottawa, where they are reporting that they have, tested positive for COVID-19, but also the Omicron variant as well. The government is trying to get a hold of things, and by minimizing travel, they feel is the first step. But I'm going to get into what the WHO says about travel bans in a minute, because they didn't necessarily agree that travel bans would be as effective in trying to get a grasp on the spread of this new variant. The travel bans don't really do anything, because if, for example, in Portugal, they had a local, like it was transmitted locally and not because people were traveling, then how would travel bans then help with that situation if people are developing or becoming positive of this variant locally as well? But we'll get into that a little bit more later. So as I mentioned, if you are of foreign nationals of the countries that I stated before, you will not be permitted entry into Canada. Of course, I said Canadians and permanent residents who recently traveled through those countries will be subject to mandatory quarantine. The federal government has also required guidance from the National Advisory Committee on Immunization on whether to bring in new standards on the use of COVID-19 booster doses in the face of this new variant. We had, booster doses had been part of the conversation when we started seeing the Delta variant spike in cases of the Delta variant spike. And now that is being pushed and propelled a little bit more now that we have this new, more transmissible, higher risk of reinfection variant essentially popping up and rearing its head now. So we kind of have an idea of what Canada's doing. The approach Canada has right now is to ban travel from the certain countries where they've seen a greater number of cases in Canada's government opinion. But what are other countries doing in terms of taking control of this new variant and how they're taking charge of their citizens and making sure that everyone is safe? Well, several other countries have also enacted travel bans focused on Southern Africa, as well as stronger screening message. So Canada's not the only one that's doing this. If you're thinking, oh, why is Canada singling anyone out? Canada's not the only country that is singling out Southern African countries or African countries in general. There are quite a few. The US has banned travel from South Africa and several other countries in the region starting Monday. Other countries like New Zealand, Israel, and even the European Union have also restricted or banned travel from the region. Japan, in fact, announced Monday that it is suspending entry of all foreign visitors, just to be on the safe side, that it doesn't matter if you're coming from a Southern African region or the EU, that all foreign visitors entry will be suspended for them. Travelers, of course, arriving from Canada and several other countries will need to show a negative COVID-19 test and quarantine for 10 days if they go to Switzerland. Now, this new measure was slated to take in effect today, Wednesday, in response to the Omicron cases in those countries. The Swiss government had already imposed the requirements on travelers from Belgium, Hong Kong, and Israel, because we know that there were cases that popped up in Belgium and Israel and even Hong Kong, and also banned all flights from Southern Africa. So this is what the Swiss government decided to do, that all flights will be banned and there would not be entry from the Southern African countries. Now let's get into the World Health Organization. It is essentially urged countries to avoid using travel restrictions, saying that they place a heavy burden on lives and livelihoods. That people who are required to travel for work or are required to be in certain spaces for work or work there and now they need to come back to work in the country that they live in, it's making it harder to do that. I mean, we saw it with other travel bans where there were students who went home thinking that, okay, we're going to be on lockdown for a few weeks. And then, the borders were closed and they were out of the country for 4 months because they weren't able to come back. That the WHO is urging countries not to enforce such heavy travel restrictions that it would place a heavy burden on lives. But of course, countries' governments will do what they want, essentially, to ensure the safety of citizens, residents, and all of that, and to ensure everyone's staying safe around the globe as well. So if you're limiting travel from all regions or from certain regions and you're not allowing people to go in and out as much, that hopefully that will help subdue the spread of this new variant. And that's what a lot of government officials are thinking, that this is the best way and the best foot forward to ensure the safety of public health. Now, a lot of question and concern has popped up regarding how effective the vaccines are for this new variant. And of course, we know that we've needed the 2 doses, and here in Canada, for a lot of things and activities that you need to do, you would need to be fully vaccinated anyway. But then they are requesting for information or how it would be possible to get booster shots or booster doses to help deal with this new variant. So just trying to understand how the new mutations might work or deal with the vaccine, the antibodies, the vaccines given to those who have already been vaccinated. Of course, more information will be coming out as more scientists and more research is done on this new variant and we get a better understanding of what's going on. But just for now, the basic understanding is that it isn't yet clear, but vaccine manufacturers are looking into how this new variant may be up against the COVID vaccine and how effective the vaccine is against the Omicron variant. Now, we are going to take a very quick break, but once we return, we're going to look more into the effectivity of the vaccines. And then for those of us who are traveling and are a little bit too worried to, hop on a plane and don't want to take the risk, we'll go into what recommendations airlines and travel insurance companies have in terms of getting refunds for your tickets. So stay tuned.
Do you want to be your own boss and make income or extra income with flexible schedule? Welcome to Keenan Courier. Keenan Courier works as a marketplace platform connecting customers who need something delivered with drivers that are willing to serve them. Courier with any vehicle, better trip allocation, and cash out your earnings whenever you want. Download our driver apps today to sign up. Do you want to be your own boss and make income or extra income with flexible schedule? Welcome to Keenan Courier. Keenan Courier works as a marketplace platform.
Hello and welcome back to the Chat Up Show. I'm your host, Elizabeth Aloidi. Now, before we went on the break, we were talking about how the COVID-19 vaccines will be effective against this new Omicron variant. As I mentioned before, we're still not sure yet, and it isn't clear yet, but vaccine manufacturers are looking into the effectivity of the vaccine against this new variant. Of course, there's been speculation about the variant's spread and how quickly it will spread alongside the rising case numbers. Experts say that it's important to keep in mind that vaccines, public health restrictions, and personal precautions will likely continue to work well to stop the spread of COVID-19 and all its variants. Because, we've got the Beta, the Delta, the Lambda, now the Omicron. We're going through the whole Greek alphabet here, apparently. With the holidays underway, we're really ramping up into festive season. Hopefully you've got your Christmas shopping done. Experts say it's also crucial to layer precautions when gathering with family. So even if you're just, going to go see your loved ones for the holidays, taking those extra precautions to make sure that you're safe as possible. We did a show on it last year that if you feel that you need to, in order to feel safe gathering this season, that you would need to require a proof of vaccination or proof of negative testing as well, on top of proof of vaccination, that's your prerogative. That's what you can do to ensure extra added safety and precautions, wearing masks, still distancing yourself, checking yourself and checking up if you are feeling any symptoms, checking your temperature, all of these things that we've been doing throughout the pandemic to keep ourselves safe. Experts say that we should continue doing it, that just because you may be fully vaccinated doesn't mean that you need to just completely relax, because this variant is still new and it's still in the research phase. Experts are still trying to understand its pattern and how it's mutating and how that could affect vaccine effectivity, how that could also affect, like the long-term effects of this new variant as well. It's going to take some time for us to truly get a grasp of what Omicron is essentially capable of. I mean, just the basic first version of COVID-19, the long-term COVID effects are still being researched till this day. People are still trying to understand how that has impacted their life. They're still trying to understand what that would mean moving forward. There are people who still have not gotten their sense of smell or even taste back. There are folks who are have developed long-term side effects from having contracted COVID before, that now everything they taste or smells or tastes like garbage or sewage, that these are things that we're now starting to see the effects of about a year and a half later of us, first dealing with this pandemic or first getting a hold of taking care of ourselves during this pandemic. it's still going to take some time to truly understand the effects of COVID-19. And as with more variants coming up and more mutations, it's going to take some time as well to figure out just what that could look like. I mean, before the vaccine even came out, health officials are saying that it's going to take about 4 to 5 years for us to truly get a grasp of what COVID-19 is. And we're only a year and a half into that. So, I mean, not to sound flippant, but buckle up, guys, because this is going to be a ride that we're going to need to stay on together. And we're all going to have to do it together. We're all going to have to take the precautions to make sure that we're all safe around one another. Even though we have relaxed a little bit since vaccination numbers are increasing daily, and now the ages that are allowed, 12 and up are already being allowed, and now I think it's 5 and up that are allowed to be vaccinated right now currently in Ontario. We still need to continue with these precautions that are on the screen right now. For example, when you're going to places, screening, checking for symptoms if people have been traveling within 14 days, if they are experiencing any kind of fever, universal masking, that it doesn't matter who or where or what you're doing, that if you can wear a mask, wear it and keep it on for as long as possible. Maintaining physical distance as well. We know that 2 meters is the limit, the minimum, that we should continue with our physical distancing, that just because majority of us, especially in the province of Ontario, are fully vaccinated, doesn't mean that now is the time to relax, especially now that we're seeing a variant that is mutating at a rate that, experts are still trying to get a grasp of, and understanding what that could look like as well. In other infection prevention measures, washing our hands regularly, hand sanitizer, wearing gloves, cleaning surfaces, making sure that things are just neat and tidy, disinfecting as much as we can. It feels like we've kind of gone back to the beginning of the pandemic a little bit with this new variant, like we're going back in time. But unless we continue to keep these precautions, unless we uphold essentially our end of the bargain as human beings living within society in general, this honestly probably will not go away. That unless we are doing what we need to do, listening to those who have done the research, listening to health officials, listening to what our leaders are saying about how to keep ourselves safe as much as possible, doing our own research as well on how to keep safe and with trusted professionals, peer-reviewed sources, figuring that out as well, just to make sure that we are taking the necessary precautions to keep ourselves safe. I think the safest bet is just stay home and self-isolate. It sounds so sad because who wants to go through another Christmas festive period isolated and in quarantine? We don't want to do that. It's not fun. We did it last year. Last year it lasted months. We don't want to have to go through that again. So the quicker we can get a grasp of this and understand it and kind of nip it in the bud, the sooner we can continue on in our progression towards going back to a life that we once, recognized before. Remember, our provincial government had said that by March 2022, hopefully we can get to a point where we won't have to wear masks at all anymore. With this new variant, that date may be pushed forward a little bit. And maybe March 22 may not be the end goal that we thought it would be because of this new pop-up in variants and mutations. And the Delta variant is still very much there and still very much present, and people are still, getting infected with that variant. And now there's a new one. So I say all this to say, we still need to maintain the same precautions, that we still need to take the necessary steps. And if we need to do a little bit more just to ensure the safety, then that's what we need to do, especially around the holidays when you're going to be seeing grandma, grandpa, uncles, kids, kids that will go back to school. We're still seeing cases pop up in public schools here in Ontario as well. We want to take those necessary precautions to protect the vulnerable communities, but just to protect everyone at large. Now, as I said, we mentioned that Ontario has now a confirmed total of 4 cases of the new Omicron coronavirus variant in the province. Ottawa Public Health confirmed Monday evening that 2 more travelers have also tested positive, as I mentioned before. The health unit said in a statement on Monday that, quote, yesterday the government of Ontario announced 2 individuals in Ottawa tested positive for the COVID-19 Omicron variant with recent travel to Nigeria. We are now aware of 2 other return travelers who have tested positive for this variant. So this was part of the statement that they put out at the beginning of this week. Also earlier, the province said that it was investigating 4 additional COVID positive people who met specific high risk criteria for the Omicron coronavirus variant. And the province's chief medical officer suggested limiting the investigation focus on returnees from South Africa, a Southern Africa country, is not a wise idea. Now, I want to pick up on that because a lot of people felt that it was a little shady. Yeah, let's say it, shady, that the focus was only on Southern African countries. But we're seeing cases happen, bringing up the example of Portugal again, those were local cases, that the focus shouldn't only be on specific regions. It should be on the fact that there is this new variant that is more transmissible, has a higher risk of reinfection. The focus should be on the fact that we need to understand this instead of just focusing on which countries right now. Of course, to get a grasp of things and to try to control as much as possible, this was the best solution quickly that the government could come up with to try and limit the spread and limits the contact of people coming in with this variant. But even the province's chief medical officer suggested that this investigation is limiting and that we shouldn't only focus on that we should look at all the cases that are coming from even other countries as well. And that Dr. Kieran Moore even said that beyond the first 2 Ottawa residents confirmed to have the Omicron variant on Sunday, there were 4 other individuals, 2 also in Ottawa and 2 in Hamilton, as I mentioned, that they were starting the investigation in Hamilton region, whose positive testing is undergoing the genomic sequencing to find out if it is they were infected with the Omicron variant. And then that can also give a better idea of where it's coming from, why there are more cases popping up, if it truly is based on travel or if there are other factors that has made this variant so transmissible in our environment in Canada. Ottawa Public Health did not say where the 2 additional travelers had been, but all 4 confirmed cases are now self-isolating. There were also 375 other returnees from 7 different Southern African countries who arrived in Ontario over the past 2 weeks, who were offered asymptomatic testing and are undergoing mandatory home quarantine. Dr. Morris told reporters on Monday that if they're positive, that we have a good local capacity to respond to them as well. That's the thing, is that we don't want the cases to continue rising to a point where our public health units are overwhelmed like they were at the beginning of the pandemic. That as long as our public health units can get a grasp of this Omicron variant quickly, then the chances of it spreading are probably less likely. That goes to understanding the variant's transmission phases, understanding what the symptoms like what makes someone high risk to this variant or how it's being spread, just understanding more just what this variant is doing. Dr. Morris said that the first 2 Ottawa residents my bad, we mentioned that before. Now, since November 5th, the province has run virtually all positive samples through the genomic sequences. So any sample that was received from November 5th up until now is going through the genomic sequencing to understand better what is happening. And it's essentially a genetic mapping procedure is conducted in a lab that can take up to 4 days to complete. So it's going to take time, as I mentioned before, to do the research that is required, to do the investigations in the lab that is required to better understand this variant. So given the fact that dozens of countries around the world have now detected at least 1 variant case, Moore said the current travel restrictions and testing guidance, which focuses on Southern African countries, doesn't make sense. I think this is a pattern that we've seen a lot during the pandemic, is that a lot of public health officials say one thing and then the government does something else, and the public health officials are saying, no, the government shouldn't have done this, that we should have focused on this instead. And there seems to be a little back and forth. But this is what our Ontario public health official is saying, Dr. Kieran Moore, that focusing on travel restrictions, even the WHO is saying it, is not necessarily the best way to move forward. That as long as we're continuing to investigate and see it, he says, quote, I think we're learning from the epidemiology of this, that this virus has been present on the globe for many, many weeks, if not months. It may be more prudent to broaden the testing of all returning travelers, not just travelers from Southern African countries, that it's now important to look at everyone who's coming. As I'm going to say it again, because there are countries across the EU as well, like that have found cases. Portugal, the local ones. If it is about making sure that people who are traveling from outside of Canada back into Canada aren't bringing it in, then this should be required for all passengers who are coming into Canada, like we were doing at the beginning of the pandemic and even last year as well when borders were closed, that these precautions were taken for everybody and not just for a specific set of people. Because if it's truly about, the overall safety of everyone, then everybody should be tested equally, because we still don't know, truthfully, how many cases are around the world. These are just reported cases of people who have been tested. We still don't understand what the asymptomatic understanding of this variant is, that if people are asymptomatic with this and still positive of the COVID-19 Omicron variant as well. It's still being investigated. We're still trying to understand it. So Dr. Moore is saying that the best approach is to just test everybody and make it as broad as possible so that there are no cracks that are found, because it's in those cracks that we start building cases. As we've noticed before, it's in those people that, were sick but were still going to work because they weren't necessarily required to be tested, or they couldn't take time off to be tested, or they couldn't even take time off to quarantine properly. That it's within those cracks in the system that allow these cases to continue to rise and continue to multiply. And now we're seeing all these mutations of these new variants as well. Now, he also goes on to say that the focus on isolating returnees and banning flights from Southern Africa has also drawn condemnation from epidemiologists, as it appears it's only punishing the South African government for being so forthright with its information. The South African government honestly did not need to report its first case to the WHO when it did. And the fact that even Netherlands had cases before South Africa had even reported it says a lot about what we're starting to understand about this variant, is that it's not just picking a certain region in the world, i.e. Southern Africa, and starting there and growing cases, that we're seeing them pop up all over the world. Which brings us back to what Dr. Kieran Moore is saying, that is that we can't just pick specific countries to target, is that we need to make sure all travelers coming from any country are tested and quarantining to keep everybody safe and to ensure even those travelers are safe themselves. Again, this is how things slip through the cracks. They went on to say that the focus on Southern Africa also ignores the fact that there have been Omicron cases found in Europe with either no history of travel to Southern Africa or travel history elsewhere. For example, in Egypt, which is another country that has been put on the list of banning foreigners from this country of coming into Canada. So there's a lot of conversation around why the government is choosing this specific route. Targeting specific countries as opposed to just doing a broad sweep on travelers and saying that every traveler that's coming into Canada, this is what you're going to have to undergo. I mean, even talking about how these restrictions haven't been put on travelers coming in from the US, which is so close to us and the borders are still open. And we still know that the Delta variant is still running rampant in the US right now, is why a lot of people are thinking that this isn't the best way to combat the issue with Omicron variant right now. He also said, Dr. Kieran Moore also said that they still do not have a definitive data on whether Omicron is more virulent or capable of vaccine escape. As I mentioned before, the effectivity of the vaccine, the COVID-19 vaccine on this new variant is still under investigation. They're still trying to understand what it's about, essentially, what it's like, what it's going to do. He also went on to say that I don't foresee us having to take any new steps at present. We will have to understand if it is more virulent or increases incidence of hospitalization. Because as we know, with fully vaccinated COVID patients, essentially, that their chances of hospitalization is lower than if you aren't fully vaccinated. But with this new variant, they're still trying to understand if it's the same case. Now, Dr. Moore was very clear that if there is a big chance in circumstance, including this new variant that is problematic, we would have to stay where we are and reassess, that we can't move forward with anything else. We may not be able to even move forward with the booster shot until we fully understand what's going on with this variant. It's a very weird limbo place to be in, because we have professionals essentially saying we still don't know what's going on. But here's the information about this new variant that now you have to worry about as well, that you have to worry about the Alpha, the Beta, the Delta, the Lambda, now the Omicron as well. All these different variants that you have to be thinking about and making sure that you're staying safe against, and you still don't fully understand what makes them different and what makes them unique just yet to each other. We know that the Omicron's mutations are mutating at a faster rate than the others, but so far that's as much as we know. Now, Christine Elliott said that her ministry was working with federal officials to bolster testing capacity at all points of entry into Ontario. So that is the broad travelers testing that Dr. Kira Morris suggested would be the best approach. So here in Ontario for us, we will probably be seeing a lot more testing upon entry, that if you've traveled out of province and you're trying to come in, there may be a little more restriction and it won't be allowed as freely as it was before. As of today, fully vaccinated travelers returning from the U.S. who spend less than 72 hours there will be exempt from showing a proof of a negative PCR test upon arrival. Fully vaccinated incoming travelers are tested at airports only on a random basis. So not everybody will be tested. You will only be tested on a random basis unless you are traveling from the 14 countries or the 14 countries that were mentioned before. The Botswanas, the Lesothos, the Namibias, the Nigerias, the Egypts, the Malawis, the South Africas, those countries. So unless you're coming from those places, you will probably not have to undergo a PCR test, and it will only be on a random basis, which is another point of concern for certain people who are like, shouldn't everybody just be tested anyway, just to be on the safe side? But who knows, maybe that's where we're going to start moving into as we start to get a better understanding of this new variant. Now, there is no word whether the federal government will move to administer the tests to everyone, as I said before. That is something that we will see, as time goes on, whether the testing will now be required for those arriving at a land border crossing or at the airport or flying in through air. Now, Quebec also announced its first confirmed case, as I mentioned earlier in the show. In response to the arrival of Omicron, the Green Party of Ontario leader Mike Schreiner called on the Ford government to make vaccination mandatory for healthcare and education workers and provide respiratory quality masks to everyone in those sectors, including the students. That we are still seeing cases pop up within the public school systems, in public schools. So to ensure that if kids are going to have to go into school, if teachers are going to have to go into work, I mean, of course, our public health workers are going to have to go into work, healthcare workers are going to have to go into work, that they should have the protection from the government to ensure that they can do their job to the best of their ability without, getting in the way of the flow of things. So providing proper quality masks, making it mandatory for the vaccination. I mean, that was put into place in our government not long ago for these sectors, actually specifically, that they would be required to be fully vaccinated. But it's understandable for a lot of people who are wondering, okay, what's the point of being fully vaccinated if we don't even fully understand if the vaccine is effective for this new variant? Just taking all the precautions that we have available to us could help in the long run. So that's where the whole stance is coming from, that we just want to take as many precautions right now. It's better to be safe than sorry. It's better now than later to then look back and regret and say, why didn't we start putting these precautions into place earlier? Why didn't we start taking things a little seriously earlier? And hopefully we'll listen to our public health officials as well, who are suggesting that we need to require all travelers or all people and not just do random testing in airports or border crossings, that everybody should be tested to ensure that nobody's coming in or out is testing positive for the COVID-19, any of the variants really, or just COVID-19 in general, just to keep everybody as safe as possible. Now, in terms of when the variant was first detected, it was first detected on November 24th in a specimen that was collected on November 9th, which is why there's the genomic testing that's happening on samples collected as of November 3rd, because our public health officials want to understand just when exactly did Omicron essentially come up in Canada? When did we first see it, truthfully? Now, according to the data submitted by South African scientists to the World Health Organization, who later labeled Omicron as a global variant of concern, this was they found that the first official case was found on the 24th of November in South Africa. But of course, Netherlands had had a case that was reported earlier than that as well. But this is just according to the data that was submitted to the WHO. Now, Dr. Peter Juni, medical director of Ontario's COVID-19 Science Advisory Table, said the public should expect Omicron to become the dominant strain of coronavirus in Ontario in a few weeks to a few months, essentially wiping out the other variants, that this is a stronger, more mutated version of the COVID-19 vaccine, which is why a lot of people are wondering why the government is taking a stance on only, limiting access from only certain countries instead of just doing a broad sweep across the globe to limit access to everybody, essentially, just to keep everybody safe. If it's going to get to a point where it's the most dominant coronavirus in our environment in only a few weeks to a few months, then it is a point of concern. Exactly why the WHO called it the variant of concern, that the rate it is mutating at is unforeseen, and our scientists are essentially just trying to get ahead of it and trying to speed up and catch up to it to try and better understand it, to better understand how we can then protect ourselves. It's a little alarming. I'm not going to sit here and act like it's not a lot of information to take in. It's not worrying. It's not worrisome, especially now that it's the Christmas season. It's the festive season. People want to gather. People want to travel. I mean, for the first time in a while, in a year and a half, it seemed that traveling would be a little bit easier now that majority of people are being fully vaccinated, and you can't even fly unless you show proof of vaccination. So folks probably felt like, okay, it's a little safer now to kind of return back to what we would normally do, return back to the traditions we once had during this time period. But now with this new variant being a great point of concern, to the point where our medical director of Ontario's COVID-19 Science Advisory Table is saying that this will become the dominant strain of COVID-19, of coronavirus in Ontario in a short amount of time, could be worrisome. But I just want to reiterate that right now, our public health officials are saying that sit tight, essentially, as more information comes out, but that we should continue with the same precautions we've been using, that they have been effective up until now for the most part, if people are doing it properly. If you are entrance screening properly, you are wearing your mask properly and as much as you can, physically distancing as much as you can, washing your hands and cleaning surfaces and disinfecting as much as you can, and just taking those precautions. We're going to have to go back to the days where we were Lysoling everything we touch. If that's what it takes right now to ensure you're staying safe and healthy during this season, then that is what our officials are encouraging us to do. It's not fun. I mean, who would have thought that, again, now we're going into 2022 still thinking about this, but we essentially just have to do whatever we can to stay safe and to stay as healthy as possible. It's hard, I know, but we got to hang in there, guys. We got to stay positive. We got to hold on to the hope. It may feel a little hopeless now. It may be a little worrisome. It may be a little scary, nerve-wracking, but just as much as you can, staying safe and staying with only your close circle or only with your household, staying home as much as possible if you can work from home and limit your interaction outside. That's probably the step we're going to slowly go into as time goes on, until we gather a little bit more information as to how this variant will impact our lives further. Now, in terms of travel, I kind of want to really focus on that. We kind of mentioned it, that there were certain countries that were on the list that were banned of foreigners from coming into the country. But, there are going to be a little bit more restrictions that are going to happen. Actually, there's a new update right now from Government Canada, is that in the coming days, all fully vaccinated travelers arriving by air from departure points other than the United States will be subject to the arrival testing. So that's updated news, breaking news right there for you. That, we mentioned earlier in the show that before it was random testing done, but now everybody will be required to do the testing. Fully vaccinated travelers will be required to quarantine while they await the results of their arrival tests. Now, just to reiterate, if you are flying in from one of the 10 countries that has been put on the essentially no-fly list. Yeah, the no-fly list. If you are a permanent resident or citizen or member, or you have status under the Indian Act, regardless of your vaccination status or having had a previous history of testing positive for COVID-19, for those who have been in any of the 10 countries in the previous 14 days, you will be subjected to enhanced pre-entry and arrival testing, screening, and quarantine measures. So if you fit under that bubble, then this is what you should probably look forward to, not look forward to, but be expecting when you're traveling back into Canada. So permanent residents, citizens, or people who with status under the Indian Act, regardless of your vaccination status, you will still be required to test upon arrival and quarantine until you receive your negative test results back. If you are unvaccinated, you will need to be tested upon arrival and then tested again on day 8 and then quarantine for 14 days. So quarantine for 14 days, and then on day 8 again, you would have to be retested just to ensure that you are still in the safe zone. Of course, if you're tested positive, you're going to have to, we know the drill. You remain in quarantine until you test negative, essentially, or until you test negative. Even if you get better and you're still testing positive, you will still need to remain in quarantine. Now, moving forward, border testing surveillance will be adjusted based on the latest available evidence to further reduce the risk of importation of this variant. So as we learn more about it, then the testing requirements will then be updated along with it. Now, in the next few days, as I mentioned, unvaccinated travelers will have to test on day 8 and quarantine for 14 days. However, those arriving by air will now be required to stay in a designated quarantine facility or an other suitable location while they await the result of their test on arrival. So you may not be able to quarantine at home unless you can prove that your home is quarantine friendly, i.e. you live alone and you will not come into interaction with anybody else for the time period you're in quarantine. This is making traveling sound like a chore, right? I'm sure a lot of people are thinking, oh my goodness, I've planned a trip now. Is it worth it to go travel because of all these new restrictions that are being put in place, or all these old restrictions popping up again that's not making it easier? Now, the government of Canada is also working collaboratively with its provincial and territorial counterparts to fully understand and grasp this new variant and how they should move in terms of the restrictions. So these may be updated as the days go on, as the weeks go on, as the months even go on. So I would suggest that you keep your eyes peeled. We will, of course, continue updating you as much as we can right here on the GBKM network. So make sure you continue to tune in to get as many updates on the situation of this new variant and how it could impact our livelihoods and our lives during this pandemic. Now, if you are somebody who has booked a flight and you're thinking, this is not what I need, I don't need this added stress, I want to cancel it, and this is enough to make you want to cancel it, here's what could happen in terms of getting refund for your ticket. Under Canada's air passenger protection regulations, passengers aren't entitled to much if an airline issues a flight cancellation prompted by a government travel ban. So if your flight is canceled because the government has said no flights from a certain area, or no flights can go to a certain area or come from a certain area, then there's not much you can get in return. The bare minimum airlines must do in such a scenario is provide a rebooking according to the APPR. So if your flight is canceled because of a travel ban, then the most they can do is just rebook you for another date, hopefully when the travel ban is lifted. But Gabor Lukács, who is president of consumer advocacy group Air Passenger Rights, says if you didn't get the service you paid for, be it a flight or vacation package, then you're entitled to a full refund under common law and provincial and federal legislation. So in other words, if you don't get what you paid for, you should get your money back. So if you couldn't fly for whatever reason, under these regulations that you could potentially get a full refund, specifically if the airline should provide a full refund in the original payment method, Lukács said. He said, if you pay $217 for airfare and $53 in taxes, then you have to get everything back together. Now, there should be no cancellation fees either. So this is for those of you who are going to be calling up your airlines and you're going to be saying, you know, your rights. These are your rights. This is what you can say to them and say that this is what I should be getting if I need to cancel, or if I am not able to travel, or if I'm not able to get the service that I paid for due to circumstances outside of my control. Now, if the airline denies you the refund and you paid with a credit card, you can then ask your credit card issuer for a chargeback. If that fails, Lukash suggests frustrated passengers resort to what's known as a statutory chargeback, which is governed by provincial law. So essentially, basically, you call until you get your money back, is what they're saying. That they should give you your money back, that you are entitled to the refund. There are some detailed guidelines. I'm sure, just look up, even on the Government Canada website, you can look up some information as to what could happen if this is what you're going to potentially be dealing with, or you're thinking about having to cancel altogether. Luckily, Lucas says that you won't have to put up quite a fight if you're booking a flight to or from the U.S., because right now the U.S. is not a no-go zone. It's still a green country to fly to or to travel to for the time being. We don't know what could happen in the next few weeks. You know, those borders might start being closed. If you're traveling to or from the U.S., from the European Union, or with U.S. or European carrier, Lucas says that you won't have to put up such a fight if you're booking within these. So if your airline is a EU carrier or European carrier or a U.S. carrier, then chances are they probably already have it in place that if it's required, you will receive your refund. Now, in terms of travel insurance, so-called trip cancellation and interruption insurance is designed to cover you for any non-refundable costs such as airfare and hotel bookings. Now, this is according to John Shmuel, who is managing editor at financial products comparison site rates.ca. However, if you decide to travel to a destination to which a do not travel government advisory applies, your policy may be void. So if you're traveling to somewhere that basically none of the Southern African countries or Nigeria or Egypt or Malawi, you will be fine, essentially, under your travel insurance. But if you were, then you may not be eligible for the compensation. And travel insurance will rarely refund you for the cost of a trip you decided to cancel by yourself. So unless it was canceled by the government due to travel bans, you will not receive the refund. So that's just some information in terms of traveling in this time period right now. If your flight is canceled because of these travel bans and you aren't able to fly out, you aren't able to receive the service that you were required, you can call up the airline, the company, whoever, to hopefully get your refund. And if that doesn't work, you could call your credit card company if you paid with a credit card for a chargeback. If you bought travel insurance and the same thing happened, if you cancel it yourself, your refund ain't coming. But if it's canceled for you, then you are eligible to a refund. So just keep that in mind if you're thinking about canceling your trips for this next year. Maybe hold on for the cancellation just to see if the travel ban just does come in for wherever it is you may be traveling to, so that then you can say, listen, this was out of my control. Either the airline will rebook you or give you a full refund. So there we have it. Merry Christmas. I think that's the best way to start off December, right? To talk about a variant that we're still trying to understand. But we're all in this together at the end of the day. The whole world is going through it together, and just staying safe is the number one thing. So just remember the precautions, wearing your mask, social distancing, making sure you are staying up to date on whatever travel bans and restrictions are in place if you are traveling. And with that, that does conclude our show for today. Thank you so much for tuning into the Chat Up Show. I've been your host, Elizabeth Lloydie. As you know, you can keep up with the GBKM network by listening and watching live 24/7 at www.gbkm.tv or www.gbkm.fm. Make sure you download our free app. Just search GBKM, available for all iOS and Android devices. Follow us on Instagram and Twitter at GBKM Network for all updates on what's going on right here on the network. And you can follow me, your host, at TIS_Liz_O on Instagram and Twitter for more updates on what's going on the Chat Up Show. And with that, I will chat with you the same time, same place next week. Take care and stay safe.
Canada's #1 African barbecue, the Suya Spot. Serving and satisfying your Suya needs from multiple locations across the GTA, including Scarborough, Toronto, Woodbridge, and Mississauga. Also located in